Hi, in this video, I'm going to teach about causes of OCD. The disorder is linked to genetic, that biologically the changes in the body's natural chemistry or brain functions, and certain factors that may increase the risk of developing or triggering OCD, including a family history. It's more common in first degree relatives. Some experts think that the OCD that begins in childhood may be different from the OCD that begins in adults. For example, a recent review of studies has shown that genes play a larger role when OCD starts in childhood, is 45 to 65%, compared to when it starts in adulthood. This is a 27 to 47% only. So, gene play a vital role in OCD. So, the serotonin and brain are interrelated to OCD. So, the brain network is responsible helping us survive day to day. Goal directed behaviors like eating, learning new informations, performing in school, your job, etc. In OCD, this neural network can be thrown off, balance producing less than desirable behavior and outcome. There is still some debate on the triggers of OCD, but it appears to be a combination of environmental triggers can include early life trauma and stress, along with brain injury or neuroinflammations episode. So, shared familial history of OCD also indicates a genetic predisposition to the disorder. OCD can start at any time, beginning as early as preschool and continuing to adulthood. So, ages at onset tends to be earlier in males than in females between the ages 6 and 15 years for males and between the age 20 and 29 years for females. And another important cause is imbalance in serotonin, dopamine, and glutamate. In the serotonin neurotransmitter play a vital role in OCD. When serotonin level is low, the person may have an anxiety disorder. So what is a normal level of serotonin in body is 50 to 200 nanogram per deciliter. So 50 to 200 nanogram per deciliter. So when the level is reducing, that time the person may experience the OCD and depressions. So which one is causing the low serotonin in your body means there will be several reasons. So one is alcohol and anger and aspartose. Okay, aspart means it is artificial non-saccharide sweetener 200 times sweeter than sucrose. It is commonly used as a sugar substitute in foods and beverages. The next is caffeine usage and digestion problems, malnutrition, poor exercise, inactivity, and hypoglycemia, not hyperglycemia, hypo. So when the sugar level is low, that time also it is one of the trigger point to increase the signs and symptoms. And smoking and stress. So these are the things. It will be reducing the serotonin neurotransmitter in your body. So when the serotonin level is reducing, there will be automatic depressions and also the OCD. So the next one is identical twins have a higher incidence rate than fraternal twins. So the next, pandas. So pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections. It's a type of OCD that occurs in childhood following the body's reactions to infections. So pandas looks very different from other forms of OCD. The most obvious difference is it happens very suddenly with the child starting to have a symptoms overnight and has a very severe impact on the child's life. So the next slide is, in the slide you can see the kids is undergoing of physical abuse and violence. This also will worsen the disease. Next, last one is loved one loss. So when you lost a person very closely related with you, that time you are undergoing so much of stress. This will also worsen the disease condition of OCD. So that's all about the causes of OCD. Once again, I will repeat. So how the OCD is causing means through genetic, identical twins, pandas, physical abuse, and loved one loss. These are the causes of main causes of OCD. Thank you.